Hey folks, John Becker here, former state representative from Claremont County, bringing to you the March issue of the Becker Report. I'm calling this the COVID edition. I actually started on this, I don't know, maybe 6 months ago, got bogged down in research, kind of moved on to some different topics. I just wasn't comfortable with the lack of data that was out there at the time. Well, now there is a lot more data, and I was able to follow up on some previous ideas that I had and some new stuff. And this is a rather extensive issue. I spent a lot of hours doing research because there's a lot of questions out there on the internet, on Facebook, a lot of questions of my own, some curiosities I had. So I dug into it to try to find reputable sources and collaborative sources to just find out what the facts are as much as possible. And frankly, there's still a lot of mysteries out there. But I will tell you what I have, and of course you can find this on beckergop.com. Click on the current edition of the Becker Report, and you can see this edition as well as the archives. So what I start out with is there's a CDC finding that only 6% of so-called COVID deaths are uniquely of COVID. Well, when I worked in the health insurance industry, we used, at the time, there was ICD-9 codes. Today they're upgraded to 10, ICD-10 codes. But anyway, so that I would routinely run reports for the clinicians on these ICD-9 codes and whether they were primary, secondary, or tertiary diagnosis to whatever illnesses or diseases that people had. So this information is readily available. I used to run it myself, and but this information is not being reported. So we don't know whether these COVID deaths are people with COVID or people of COVID. The information is just not publicly available, and that seems to be a mystery. So regarding 94% of all of the COVID deaths, we don't know. We don't know if they were people that died with it or of it. And for whatever reason, the health departments and the CDC won't tell us. So then I move on to talk about some examples. Texas, for example, with their mask mandate and what happened to them after they eliminated it. And you'll be pleased to know nothing. That the wheels didn't come off the state of Texas. The COVID numbers didn't change. So getting rid of the mask mandates was a good thing. So I also have in here, I'm just going to read you a couple of sentences, a paragraph. The science shows that the effectiveness of mask mandates are negligible and laughable. So I'm saying that because there was a CDC study, and there's been other studies. I've been kind of watching these studies for a long time on face coverings and masks and different types of masks and what good they do, if any. So, for example, some people were saying, it's like using a chain link fence to stop a mosquito. Well, that is true because it has to do with the size of the virus, and it is smaller than the virus is much smaller than the pores in a mask. Well, the CDC comes back and argues, it's like, well, these droplets or these viruses are contained in droplets, and the droplet is larger than the pores in the mask, or in essence, like the chain link fence, if you will. Well, that might be true. So yes, some of those droplets might be stopped, but when those droplets evaporate, of course, that virus is going to keep going. So these are the reasons why the studies from the CDC and other organizations show that the masks are simply ineffective. I mean, the best case scenario is like 1.8% effectiveness. Well, that's negligible and laughable. So that also explains why only government could create such an idiotic policy. No surprise there. And then political leaders wonder why we think they're so stupid. Well, if you're a political leader and you're wondering why people think you're stupid, take a look at your mask policy. As a final thought on masks, my research has concluded that they are just as effective as a training bra on a prepubescent girl. That is there for social purposes only. I also have a link in there to a YouTube video. It's always been my favorite. It's a man named Dr. Noel, or Noel, not sure how you pronounce that, but he shows the different varieties of masks, and he uses a vaping mechanism, vape, like tobacco, but it's a vapor rather than smoke. and he demonstrates multiple different masks, and it's pretty funny watching all this vapor blowing out. Just an indication, yeah, the water droplets, the viruses, these masks do not protect other people. But some of these masks will protect the people wearing them, the N95 specifically. So if you're interested in protecting yourself, get a well-fitted N95. If you're interested in protecting others, don't leave the house, because there is no mask that's going to help protect others from you. So then I'll move on to a section regarding the business restrictions, and this a lot of this data kind of goes hand in hand with the masks, and it's similar results. The business restrictions, and I list a number of a hyperlink, a number of studies in different parts of the globe, and they're simply ineffective. There's any correlation between these restrictions and minimizing the spread of COVID is specious. It's nominal, if any at all. Certainly nowhere rising to the level of justifying destroying businesses and people's lives. So this is just confirming evidence that the politicians that are enforcing these restrictions are simply out of touch with the science. Also have there's California versus Florida, two different states with very different policies. Florida is wide open, California is shut down. Their spread of COVID is very similar. There's no significant difference between the two states. So which state would you rather live in? I get into the coronavirus.gov statistics from Ohio. So these numbers are specific to Ohio. I got a whole page here. So for example, there are currently 1,617 active cases in Ohio. 1,617. Well, does that sound like a big number? Well, there's 11.7 million people in the state of Ohio. So how many people in the state of Ohio are currently infected with COVID? Well, that is like 1/100th of 1% of the population. I wouldn't call that a significant number. There's also something to consider. There's allegations about healthcare facilities are incentivized to financially to increase their numbers? Well, the answer is yes. For Medicare, there is a 20% supplement. Now, is fraud being created from that? Well, we don't know. We don't know. They claim that there is not, but clearly there is a financial and a substantial financial incentive to misreport these numbers and call people COVID when they are not, or not legitimately. Not saying this is happening. I'm just saying the potential is certainly there, and the financial rewards for it are certainly in place. So some of the key metrics from the Ohio coronavirus website. So 52% of the deaths, and there's been like, I think the 18,609 deaths in the state of Ohio. So again, out of 11.7 million people, you can do the math on that yourself. But so 52% of those 18,000 are people 80 years old or older. So more than half are in their 80s or older. 79% of the total deaths are people in their 70s or older. And 93% of those total deaths are people in their 60s and older. So then I did the survival rate by age band. So if you are in your 80s or older and you catch COVID, you have an 81.3% chance of survival. 81.3% chance of survival if you get COVID and you're in your 80s or older. If you're in the 70s, 79 age band and you get COVID, your chances of survival is 92.8%. And these numbers all come from the coronavirus.gov website, so you can check these for yourself. The 60 to 69% band, you have a 97.8% survival rate. If you're 50 to 59, your survival rate if you get COVID, 99.4%. Ages 40 to 49, 99.8% survival. Ages 30 to 39, 99.9% survival. And then for everybody else under age 30, it's virtually 100%. This is, and this data is as of March 30th, 2021. So I would also compare this, and I looked at the traffic accident fatalities. So if you are working age, certainly under 60, 65, I would even go that high, although I don't have that breakdown between 60 and 65. But just looking at the numbers are clearly under age 60. Your chances of dying in a traffic fatality are greater than your chances of dying of COVID. So, I mean, I get asked that question from family members. Aren't you afraid of COVID? I said, well, I'm not any more afraid of that than I am driving a car. So, I mean, it's just a matter of putting the risk in perspective. So then what about the vaccines? So the vaccines, are in fact experimental. That was something I looked up as well, because they have what's called an emergency use authorization. That doesn't mean they're dangerous. Frankly, we just don't know. There's really no reason to believe that they're dangerous, but all the data is not in either. So, there has been a lot of testing going on. I really don't have any concerns about the vaccines myself, but just something people need to know. They are experimental. They are not the final. Also then, I quote a number of other studies in here, and some of these has to do with where fetal cells, aborted baby parts used in the vaccine. So I looked into that as well, and the answer is it depends entirely on how you ask the question. So there's two manufacturers that are at least having vaccines in this country. It's AstraZeneca and it's J&J. Both of those developed their vaccines from what's called fetal cell lines. And I hyperlinked all that in here. You can go study what that means for yourself. So these were babies that were killed, I think back in the 1970s. And they've been using their body for, experimental research ever since. And then, so there has been these fetal cell lines over these decades have developed and grown in petri dishes, and I'm not sure how to explain it, but you'd have to you can read it for yourself. So the bottom line is there is an abortion connection to the J&J and the AstraZeneca vaccines, but there doesn't appear to be any reason to believe that there's any kind of fetal cell tissue in the vaccine itself, but they were developed from fetal cell tissue. And I hope that clears things up and makes sense. So then what I concluded with was, this is something that I had suspected or heard some time ago, is what is a COVID death? Are people dying with COVID or of COVID? Well, one way to kind of look at that is, okay, what's the total number of deaths in 2020 versus 2019? Has the number of deaths in 2020 of all causes, it's all causes regardless, has it appreciately increased or has it been flat? And there's been, and I put this out on Facebook. Hey folks, help me out, point me in a direction. So, and they did, and I found some research on that, and I had to run some numbers, and concluded that, there's a very substantial increase in the number of deaths in 2020 over 2019. It's in the range of like 17%. So, and clearly those deaths are associated in some way with COVID. But to what degree, we don't know, because a lot of these deaths are also, suicides and drug abuse caused by government-mandated isolation and loneliness. So there's a lot of fingers to get pointed in terms of this increase in deaths. But clearly, there's a big increase in deaths, and most of that is going to be associated with the coronavirus. So with that, again, I'm John Becker. And you can subscribe to the Becker Report. Go out to beckergop.com. My contact information is at the end of this video. Make sure you subscribe to my YouTube channel and subscribe to the Becker Report. And have a great day. Bye-bye.